Ebola, 2014 to 2016. Ebola virus is a rare and deadly disease that affects people and non-human primates. Ebola was first discovered in 1976 near the Ebola River in what we now know as the Democratic Republic of Congo. It was aptly named after the Ebola River. Since its discovery, the virus has been infecting people from time to time, leading to outbreaks in several African countries. The most recent outbreak is the largest in history. It affected countries in West Africa, predominantly Guinea, but it soon spread to neighboring countries such as Liberia and Sierra Leone. By the end of the epidemic, a dozen countries had experienced cases of Ebola, such as the United States, United Kingdom, Spain, Senegal, Nigeria, Mali, Italy, and the three mentioned above, Guinea, Liberia, and Sierra Leone. In the span of 2 years, a total of 28,616 cases were reported, and 11,310 deaths occurred within Guinea, Liberia, and Sierra Leone. 35 additional cases and 15 deaths were reported outside of these three countries. Most of these cases were from volunteers and doctors helping the ill. They were flown to their respective countries. The virus can only be passed when symptoms are present. It is not contagious during the incubation period. Symptoms appear anywhere between 2 to 21 days after contact with the virus and usually progress from dry to wet symptoms. Dry symptoms include fever, aches, pain, weakness, and fatigue, while wet symptoms include diarrhea, vomiting, and unexplained hemorrhaging or bleeding. Symptoms are very similar to other more common diseases such as malaria and typhoid fever, so even with symptoms present, possible exposure is needed to confirm the diagnosis of Ebola. When Ebola was first discovered in 1976, scientists were unaware of the different species in the genus Ebola, including the Zaire Ebola virus, which is the one responsible for the 2014 and 2016 outbreak, the Sudan Ebola virus, Thai Forest Ebola virus, Bundinigo Ebola virus, Reston Ebola virus, and the B&B Bali Ebola virus, the last two which are not deadly to humans. People are initially infected with Ebola through contact with an infected animal. Evidence suggests that bats are the reservoir hosts, meaning they do not show symptoms of the disease and can carry it and transmit it without being affected. Bats then transmit to other animals such as apes, monkeys, gorillas, chimps, and humans. Gorillas and chimps are dead ends, so similar to humans, they succumb to the disease and cannot carry it like bats can without being affected. When a reservoir host transmits a disease to another animal, it is known as a spillover event. Once a human is infected with the Ebola virus, transmission from one human to another spreads through direct contact with blood or bodily fluids of an infected individual. Poor nursing techniques and early outbreaks were the source of many human-to-human transmission. By poor nursing techniques, we mean not properly using PPE, personal protective equipment, and not following proper sterilization techniques. The picture, taken from the CDC website, displays and describes how the virus is passed from a reservoir host to other animals/humans, and then from human to human, leading to death or survival. Even after an individual has succumbed to the disease, their bodily fluids still carry the virus and can infect those that come into contact. Therefore, traditional funeral practices are dangerous. Treatments include providing fluids and electrolytes through infusion into the vein, offering oxygen therapy to maintain oxygen status, using medication to support blood pressure, reduce vomiting and diarrhea, and to manage fever and pain. There is currently no antiviral drug licensed by the US FDA. During the most recent outbreak, 4 investigational treatments were initially available to treat patients with confirmed Ebola. 2 of these treatments, called the Regeneron and MAB114, improved overall survival. These 2 antiviral drugs currently remain in use for patients with confirmed Ebola. Recovery from Ebola depends on a good supportive care and the patient's immune response. Investigational treatments are also increasing overall survival. Those who do recover develop antibodies that can last 10 years, possibly longer. Survivors are thought to have some protective immunity to the type of Ebola that sickened them. It is not known if people who recover are immune for life or if they can later become infected with a different species of Ebola virus. Some survivors may have long-term complications. In most cases, people who have completely recovered from Ebola do not become reinfected. However, many survivors suffer from health issues after recovery from Ebola. The most commonly reported complications are tiredness, headaches, muscle and joint pain, eye and vision problems, which include blurry vision, pain, redness, and light sensitivity, weight gain, stomach pain, or loss of appetite. The way the world views the disease is super deadly viral infection with no treatment. We had a total of 11 cases in the United States with 2 deaths. Prior to COVID-19, Ebola had been the most memorable epidemic because it affected so many people and took the lives of so many. There was large media coverage, it was talked about daily on the news, and updates were consistent. However, unlike COVID, Ebola did not hit too close to home. For the most part, it was contained in Africa. Ebola had claimed the lives of thousands, and there is still no certified antiviral drug, but for now, it has been contained. Thank you. It's my works cited page.